In today's world of technological advancement and AI, the entire field of healthcare and medicine has taken a big leap ahead in terms of good patient care and safety. Hello, I am Dr. Shalini Singh. I am the Director Lab Operations at Ampath, based out of Seattle, Hyderabad. And today I would be speaking a little on the importance of medical laboratory testing in the early diagnosis and treatment of a patient, and a small brief on complete blood count, which is also known as CBC. So lab tests are very important nowadays because they are the first tool and the most common tool that a clinician uses to reach to a diagnosis, or for him to indicate that what the diagnosis of the patient may be. The patient can actually know what kind of diseases or what kind of conditions he may have to face in the future, so that he can take appropriate precautions and preventions at the right time. Screening tests are done most often when the patient does not have very evident signs and symptoms of a disease, and they do certain tests for which we get some results, and we can actually know that this patient may have the disorder, and he can actually go and confirm whether the disease is present or not through some confirmatory or diagnostic tests. And diagnostic tests are usually done first as a reflex of a screening test which was already done, or if there are some evident signs and symptoms present in the patient who has gone to the doctor, he can write the diagnostic tests directly and come to a conclusion and plan the management of the patient. We do put a lot of emphasis on providing a clinical history along with the test request, so that when we are interpreting the result in the laboratory, we can actually look at a holistic picture and interpret that result in very customized manner, because what may be normal in my blood for another person with some given symptoms and signs that may not be normal for that patient. I would now like to speak a little on CBC test, because CBC test is amongst the most written tests put across a full form, which is also called as complete blood count. So as the name suggests, whatever is present in the blood, whatever elements are present in the blood, what we do through the CBC test is we try to analyze those components, we try to count those components, we try to see the morphology of these components and reach to a conclusion as to what may be there in the patient, so that the doctor can act on it. So blood usually mostly comprises of RBCs, which are your red blood cells, the WBCs, which are the white blood cells, and the platelets. While we read a CBC test, so there are a lot of, whenever you read your CBC report, you would be seeing RBC indices and RBC related values. There would be some WBC and WBC related components, and there would be some platelets and platelet related components. So and plus with all of this, there would be something called as HB, which is also called as hemoglobin. So all in all, these are the four things which we mostly see in a CBC report. Coming on to the first one, when you go through a CBC report, the first thing that you may see is a hemoglobin. The hemoglobin is a very generally used term, and most of you would be knowing that we use that very commonly in our day-to-day life, that hemoglobin is high, hemoglobin is low. So that we interpret through that report through a given set of ranges. So these ranges also vary from age to age. The normal ranges vary from age to age, and they also vary with gender. So at times, if you compare a report of a male and a female, the reference range for hemoglobin will be different, because what is expected reference range in a female may be different in the male population, and we interpret the result based on that reference range. So if the hemoglobin is below a certain limit as it is given in the reference range, we say that the patient is anemic, and if it is normal, we say it is normal. And then we go and start analyzing the RBC parameters, where we give a RBC count which is given in millions. Then we analyze the RBC indices. So you must be seeing MCV, MCH, MCHC. So all these parameters and all these indices indicate to us if there is a low hemoglobin and if there is a low or a high RBC count, then what kind of a RBC related condition that patient may be facing. So it may be an iron deficiency, which is one of the most common causes of low hemoglobin in our population. or it may be because of vitamin B12 and folic acid deficiency. The other important parameter that we read in a CBC report is a WBC count and the differential count. So WBCs are white blood cells. Basically, these cells are important for our body's immunity. So when we are looking at this WBC count, we look at the count whether it is low or high. A low count usually indicates towards that the immunity may be impacted a little bit, and this is in very layman terms I'm trying to explain here. And if the WBC count is a little on the higher side, then it indicates towards some kind of infection. Now WBC can be broken down into a lot of components. If the neutrophil count and the neutrophil percentage is high, along with the WBC count, it indicates towards an acute or a bacterial infection. If the lymphocytes count are a little high, it indicates towards a viral infection or some uncommon bacteria like Salmonella. So these are the very common ones that I'm trying to explain to you here. Again, one of the most important differential component is eosinophil percentage, which we get as an individual request also, because if eosinophils are high, it indicates towards that the patient may be allergic and he may be hypersensitive to some of the components which are present in our environment or something that we are eating. Another thing which very important comes on a CBC report is a platelet count, which it's become a very common term, platelet count, because of course of dengue and chikungunya, because the counts are affected in these disorders. So if the platelet count is lower than the reference range that is given, but then again the history of that patient and of course the seasonal waves that we see, we have to read it in conjunction with that. So every low platelet count does not mean that it's a dengue or a chikungunya. Of course, signs, symptoms, clinical history from where you are, and what season we are going through, everything is important when we try to interpret that report. The information that a CBC report can give is absolutely very relevant and very important, hence it is the most common test. There's a lot of detail that can still come out through the CBC report, and which will take a lot of time for me to explain to here. That we can, if required, we can always extend this session in further videos, but don't take these routine tests as routine. They're very important, and they do give a lot of information, if not to you, to the doctor, and definitely get them done whenever they are asked for, not just when you are ill, but also as a routine examination or a yearly examination if you can get it done. Thank you.